the up and up though. I didn't pay
Yeah.
attention much to Detroit's draft, but man, they made it pretty far last season, so they made it to the NFC Championship. So
Yeah. I think they'll be one of the two strongest ones in their division, but
for sure,
yeah. Oh yeah, yeah. No, and the city did look great. The
it
city
did.
did look really, really great.
It was
Everybody
packed,
did a really good
packed
job of
house.
cleaning it up for that.
I thought it was fun seeing the Detroit fans. They had all the bling on and these crazy outfits.
you're, you're right, Don. Detroit doesn't get much props. You're right.
Well, props to them.
But us
I thought
Florida
I
boys.
thought it was fun. It was a good draft.
Yeah. Oh yeah. Yeah. So
But
hopefully they'll keep moving around to those smaller cities. But
maybe eventually
let's
they'll end
get
up in
let's get
Jax.
rocking. Oh gosh.
Maybe in the next decade or so.
I don't know, man. After having the Super Bowl here that one time, I was like, forget this.
Nah, there's still much that needs to get done here. Honestly, there's no way it's doable right now. But we'll go ahead and get it rocking. Appreciate everybody
Yeah.
joining. And uh for those of you that are joining here for the first time, we do a weekly trivia quiz just on last week's presentation. Last week we did a presentation on EHR structure and essentially the benefits of having an EHR system in place. And so that's what the trivia question is going to be based off of. I'm going to go ahead and share screen, and you guys feel free to put your answers in chat. And yeah, we'll go from there. Jose, let me know if you can see.
I can see it.
Awesome. So let's get it going. So today's trivia question is, which of the following is not a benefit of structured electronic health records or EHRs? The choices are A, enhanced patient care, B, improved data-driven decision making, C, increased administrative burdens, or D, facilitated interoperability. You guys can go ahead and put your answers in chat. We'll give it about a minute or less. Don and Dana say C. Anybody else? Feel free. If you weren't on last week's webinar, not a big deal. You can take an educated guess.
And catch up. We've got the YouTube channel, so you can check it out on there if you
Yep.
ever miss.
Camera looks a little off. Let's fix that real fast. There we go.
Cool.
Cool. So again, the question was, which of the following is not a benefit of structured electronic health records? Choices were A, enhanced patient care, B, improved data-driven decision-making, C, increased administrative burdens, and D, facilitated interoperability. The answer is, in fact, C. Good job, everybody. Increased administrative burdens. Structured electronic health records are designed to reduce administrative burdens by optimizing clinical workflows and automating data entry processes. So again, pat your guys selves on the back, and we'll go ahead and dive into today's presentation. In just a second here, get that pulled up. Jose, let me know if you can see.
Yep.
Sweet. So again, for those of you that are joining here new, welcome to today's session. My name is Ray Walters. I'm with Epi Compliance. I will be today's your host for today's session, and have my co-host here, Mr. Jose Delgado. For those of you
Doing everybody.
again, for those of you that are new, Jose is a jack of all trades, I would say, but he has over 17 years of experience in healthcare consulting, administrative, and also he currently owns a mental telehealth clinic. Jose, I don't know if you want to add anything to that.
No. Let's punch it, because I'm sure that some of the stuff that we do on the side, especially on the consulting side, it'll get brought up here on
Yeah,
on this topic.
we'll go ahead and dive into the subject. We'll talk a little bit about EPI compliance at the end, but this particular subject, this is essentially part two. We did a presentation, what was it, last month, Jose, on the Change Healthcare cyber attack
Yes.
that happened in
Yes.
late February, and it's affected quite a bit of practices. And I would say it's safe to say there's probably some practices or some participants on this call that practices were affected by, and want to do just a sort of a follow-up presentation to that last presentation, because apparently at this point we're sort of going through the lawsuit process, right?
Well, not only that, but there over the last 10 days, there's been quite a few updates that if you are paying attention to only the major media, you're not going to hear about it. But if you've got your ear to the ground and you're paying attention to a little bit more of the healthcare media, they've been really tracking it down. One of the main ones is that if your systems are heavy into the Change Healthcare system, it's not that they fixed it; it's that they officially paid the ransom. That was confirmed last week.
Which is
So
what was that dollar
it's not
amount?
necessarily that they were able to solve the problem. So the
Yeah,
problem is still there.
problem is still there.
Um,
100%.
yes. Hopefully, they've at least identified the vector of the attack. It's gonna be very interesting. As of as you can see here, as the beginning of this past month, 24 class action lawsuits had already been filed, and what Change was trying to do is that they identified these 24 cases and were trying to put them all together into one major class action lawsuit to take place in their home state of Tennessee. We'll see how that works out for them. I imagine that they'll be able to group a few of these together. I imagine that they'll be able to pay and settle some of these out beforehand. I'm sure that quite a few of these class action lawsuits are CYA lawsuits in respect of, hey, you're a business associate of mine, you screwed me, and now I could potentially get in trouble because these are my patients, and as covered entities, at the end of the day, the federal government is going to come to who? The covered entity. Change Healthcare is considered a business associate for everybody involved in this, but they're not the covered entity. So it's very interesting to see how this is going to affect the legalese behind the BAAs down the road and the business associates and the different guarantees that we're going to be needing to get from our vendors, because this just showed the consolidation that's been happening over the last couple of years is um, problematic. Let's just put it that way. Health IT has been very lazy. All everybody's been doing is just white labeling stuff. They'll buy the company, they'll white label it, white label the product, they'll work with the company, just white label their service, and then move on and sell it like it's theirs, which is what's happening with all of these, with Change Healthcare specifically, and all these clearinghouses, because there's really only five big clearinghouses that everybody uses. So it's a tricky wicket. I'm curious to see the loans that United Healthcare is going to be that they've been giving out to everybody, or the prepayments in order to keep things kind of civil. If they're going to just forgive those and call that a payout, which would be the smart move on their part, so that way they can prevent how many lawsuits they're going to have. I do know that in the congressional meeting that Raskins had about 2 weeks ago,
Mhm.
there were representatives for Change. There were representatives for the subsidiary between Change and United Health Group, but there was not a representative for United Health Group to show up. And Jamie Raskins and a few other congressmen were very quick to
Call them
go
out.
to the media and say, "Hey, where are you?" And I'm sure that United Health Group is going to maintain the, "Hey, yeah, they're a company of ours, but they're not. It's not my fault." I jokingly call this the, "Hey, yeah, that's my kid that got in trouble at school. I'll claim him because he's my kid, but my kid did that. I didn't do that."
Don had a
So
question, Jose. Um,
yeah,
She said that her EHR told them they had no choice but to use chain
Yeah, I
zones.
just
So
saw that. I'm not surprised that eClinical is going to do that. I imagine that they're going to try to maintain the status quo no matter what. And the argument is going to be, well, if they could get the change, they can get to any of them. So why move everything? This is where the contingency plans come into place.
mhm,
This is where your critical system inventories come into place. This is where the opaqueness by which the EHRs and the how can I put this? The billing side of healthcare that has been opaque for the last 20 years and how they do things and what they do. I mean, why do we even have clearinghouses anymore? They don't do anything now. They used to do something, but now they don't do anything. Why are they still part of the system? We can get rid of them entirely and not have it and clean and streamline everything because all of these EHRs, they're all certified by the federal government. But what does that mean? What does that mean? These clearinghouses, they don't have any regulations on them other than HIPAA.
right.
So I mean, I'm really curious to see how this is all going to go. I imagine that United's going to get sued. They're going to try to move some of the lawsuits up to United because United has more money than Change does. I believe Change has been working under a loss for a while. This is going to make consolidations a lot more difficult as well because the FTC had concerns about United Health Group acquiring Change when they did 2 years ago. So this is also going to be a problem. Dawn, I would say take a look and see if there's an out um, with your, if you have a lawyer, if you don't have a lawyer, let me know. I'm more than happy to make a few phone calls and see what we can do for you on that side. It'll be interesting. If I'm an EHR and currently with my practice, I have been going to every single vendor and I've told them flat out, I want a list of every single vendor that you have that is working on my stuff that has PHI. I want a list. It's non-negotiable.
Hmm.
As expected, the one that's been most difficult is Practice Fusion, my EHR, because they don't want anything to do with this conversation. Even having the conversation with my EHR and saying, "Hey, look, I need proof that you guys are doing your SRA. I need proof that you guys are doing some kind of breach temps. I need proof that you guys are doing anything compliance related because I don't have anything." Customer
But
service goes and says, "Hey, you can look us up over on the OCR website or the OCR website, and we are one of the certified EHRs." And I'm like, that doesn't mean shit.
doesn't
That means
doesn't
that means you're capable of doing it, but that doesn't mean you're able to do it. And I mean, I'll flat out say it. There are issues with every single EHR if you know where to look, even on the, especially on the audit trail side of things, which Practice Fusion has an issue with their audit trail and their compliance therein. And I don't think they're ever going to change that. I think they're just going to be aware of it and have a mitigating factor and move on, and just say, screw it, we can't be perfect. Um, Dawn, I would honestly ask you that it may be an executive team conversation. You need to sit down and say, hey, look, we have no guarantee this is going to happen again. Usually these ransom guys don't like to hit the same person twice. I mean, I would love to know how much the payout was.
well, I was gonna
I would
say
love, I
there's
I
gonna be an
mean,
article that will surface that'll disclose that, I'm
I
sure,
mean,
soon enough.
it's probably a number so high that you don't have to work
I
again
was actually kind of surprised. I figured it'd be some way more than 24 lawsuits. I thought there'd be.
for now.
I mean, it's
That's for
exact. I
now.
mean, this is relatively
Those
fresh. You're right. That's
and
just
remember that these are class actions. So when you're talking about this isn't, yeah, it may be one lawsuit, but there may be 1,000 plaintiffs.
true. True.
So, you could have an ACO in
I
here.
want to find out that
An ACO,
information too. I'm hoping they release something.
yeah, I mean, you could have an ACO in here right now, and that would be, 500 providers.
Right.
You could have one of these pharmacy benefit management companies offering work to a Medicare Advantage company. That's one lawsuit, but their losses are going to be in the tens of millions.
Don, you're probably in there, aren't you?
If Dawn, if you haven't been contacted by anybody, you definitely have a case on your hands. And
Yeah.
potentially, and this is the scary part, right? Potentially, eClinicals has exposure here. Yeah,
Nice.
potentially eClinicals has exposure here because of the fact that Change is part of their ecosystem, is a vendor of their EHR. Now, this is also where at the beginning of the month, you had all the hospital lobbies and the insurance lobbies talking to the federal government and requesting, hey, do we have to report the breach as well? Because the way this trickle downs normally is that on that on that bad boy checklist, which check our first video from this year, and you can find out about that no
The
list.
the naughty list.
Every single company that touched Change would have to report the breach. So
Wow.
then I could potentially be getting notifications of the same exact breach from my provider, the EHR the provider uses, Change Healthcare. If I'm a patient, I'm freaking out. Well, wait, is this three separate instances that my information is out there, or is there just the one? Now, this is such a large situation. Normally, when these cases come through, you have the BAA, which protects the provider, the covered entity, from anything your business associate does. However, normally in these breaches, you're still mentioned. So you remember, Ray, when we brought up the no list, it was the name of the
Name of the
practice,
practice, and
and
then
then it was the cause. And
right.
it was, oh, and if it said business associate, or it said what was the other term for it? Like vendor or something like that,
I think it said
where they're
subcontractor or vendor.
subcontractor, that's what it
Yep.
was. So when you have this kind of a situation, we could really there's going to need to be some guidance here, and there's going to need to be some court maneuvering. Dawn, I would definitely say anybody using eClinicals, there's a class action for you somewhere in there, just for the loss of revenue. But does that solve the problem? No, it doesn't really solve the problem. They're going to end up paying a fine, and everybody's going to move on. But with us, as the covered entities, as the buck stops with us because we're the ones closest to the patient, what happens? What do how do we walk the patient through this? How do we calm the patient down? Well, I mean, again, if changes my clearinghouse through my EHR, and my EHR does not have a backup clearinghouse, which is one conversation that everybody's been having, that an EHR should now have multiple clearinghouses so that way they can protect from this kind of disruption. You won't
Sure.
protect from the breach, but at least you'll be able to mitigate the damage from the disruption aspect of normal business. Um, I don't know how that's going to work, because I doubt that there's going to be a lot of companies that are going to want to play that Robin position to somebody else's Batman, where, hey, all right, cool, you have a contract with us, it's business with us, but it only happens if homeboy screws up over there. It's I the backup option is an interesting one, but I don't know how actually feasible it will be. There's also talk of decentralizing the healthcare system more, which you could do if you got rid of the bloody clearinghouses. Because anybody that's messed with billing knows this is just like a freaking credit card processing fee on every transaction, but there's no reason for it, because the clearinghouse is supposed to go and transform the information that we send out on our claims into a format that the insurances can understand so they can pay us faster, which made sense when we were faxing and mailing these 1500, these CMS 1500 forms, or every insurance had a different billing form, or your workers' comp form, or your this form, or your that form. All that shit's done electronically now. I know there's quite a few EHRs that have their own clearinghouse. Granted, they don't have they don't have as much bargaining power because it's just based off the clients in the EHR, which is why they use companies like Change. Um, there's a couple different options there as well. You can decentralize even more so. You can go and instead of bringing billing in-house, maybe it's a conversation that we bring billing outsourced and put that onto a billing company where then they have their own insurance that would then be able to cover you if this happens on the monetary side, but it doesn't solve the breach issue. So this is going to be a very, very interesting conversation. I'm sure that the
I,
courts,
I was gonna
no one's
say
going to jail.
I can't see them doing away with clearinghouses, but I think to your point, the EHRs might just have to partner with multiple clearinghouses in case these situations arise. And
I
one
mean,
thing that stood out in the article to me as well, and I posted that article in a chat for you guys to review, but it says the Office of Civil Rights tracked 256% increase in large breaches over the past 5 years, and it kind
now
of to
there's
your
a reason for that as well, though.
yeah.
There's a couple of reasons for the increase. One, this is just like the increase, and I'm going to use the mental health condition side of things because I deal with it every day. Um, there's a large increase in diagnosis of depression and anxiety,
Mhm.
just as there is with children with autism. Why? Because we're more sensitive to testing for it. That doesn't necessarily mean that there's more breaches, which there probably are more because of the level of sophistication needed, how many countries around the world have better internet access, because that's also part of the problem. We're
Right.
never going to catch these guys. The guys that actually did this, we're never going to
What was
catch them.
it? What was the group? Black Cat or something?
Yeah, yeah. So I mean, all of these companies are based, all these consortiums are based out of Eastern Bloc of Europe, oh, out of Russia itself, out of China, some of them out of India. You're never getting them to the States. You're never going to get them. So there's no way for us to use the normal process of the legal system to extract some kind of justice. So the person left holding the bag, sadly, is Change. And I say sadly because, that they could have gone after anybody, honestly.
Mhm.
They just picked Change and they were like, well, let's get them. And they got them good. And they got the entire US healthcare system. I
What
mean,
was the
when
article? It said 2/3 of the population
one
were
third of
affected, or
one
one
third of
third, one
patients in the
third.
entire US. So if you look at the population of around about 300 to 350 million. I think the last number I saw was like 325 million. Doesn't include all the
Wow.
illegals that are also in here as well. It doesn't include all the newborns that are coming in every day. Um, you're looking at 100 million lives are affected by this breach because of how much information goes through there. Now it's going to be skewed to one side versus the other because most kids don't have they don't go to the doctor very often, right? Unless they're absolute babies. Their information isn't the one that these guys are going to go for. It's going to be their parents' information.
Right. Makes
It's going to be a lot of Medicare lives that are going to be affected by this. Um, Now, the type of information that they got, nobody has a clue. And that's part of the other problem, too. When we look at these breaches, it's hard to tell if these hackers are going for all information about a person or if they're targeting specific information. Just enough to get, for example, a credit card which what do I need? I don't even need to prove I have a pulse to get a credit card, right? Like I gotta have a name, I gotta have a social, I gotta have an address to send a bill to.
Yeah.
I think that's it. I got a proof of income or an income number, right? I don't even have to prove that's my income. I just have the income number, which you get off of a face sheet, off a demographics form, because usually there's employer on demographics forms. I mean, you've got everything you need. You don't have enough to get a mortgage on somebody, but I mean, a $2,000 credit card, maybe a $30,000 car.
Stuff
You
that you don't want
know,
to deal with. Bottom
yeah,
line. Bottom
absolutely.
line.
Absolutely. So I mean, I'm very curious to see what's going to happen. And anybody that's been in the legal side of healthcare and the IT side of healthcare has been talking about data breaches in healthcare for the last 10 years and the prevalence for it. The only thing we can do as covered entities is try to protect ourselves and our patients as much as possible. And a lot of the things that we can protect are the common sense items, right? If you buy a computer, don't let the antivirus expire and not have something there. If you have an IT company that is doing passive antivirus, passive malware, included on every single device. Um, don't use your cell phones for different things. I mean, there's all kinds of different ways that these guys get into systems. For a while there, it was the emails, because they would catch an employee's email, they would send a random thing, and then the person would open the email. So don't have people checking their personal email at work. There are certain websites that are notorious for having people piggybacking. A lot of those have been picked off, but it's still the only thing that we can do is the simple things because these guys are getting more sophisticated. And honestly, the only way to get complete security on this data is no one can access it. It's in a vault.
I would
If I
add,
can't use it, then it's completely pointless to me, right? So we're always going to be on this seesaw of compliance versus convenience. We have to be aware of, and everyone and every single company involved in healthcare in the US, especially, should be paying attention and have a list of attack vectors that they know based on a security risk analysis, based on breaches, and you should work on how to deal with these kinds of scenarios when they occur. And that's where your contingency plans come into
planning.
place, your critical system inventories come into place. If we're in Florida, so hey, if the electrical grid goes down, you only have a matter of time before you can access the EHR. What do you need to be able to see your patients? If you have your EHR goes down, your billing system goes down, like with change, how do we adjust? How do we pivot so we can maintain as much of our daily operations as possible? So this is going to be something that people are going to have to, sadly, we're going to have to learn from. And trust but verify is going to be very much a figure of practice now, even with these larger organizations that you would assume are doing
Have
everything
it
right.
together.
Yeah, you would assume that they have it together. And I mean, you know what happens when you assume, right? So it's it sucks, honestly. I mean, because you're sitting here, like Dawn, I'm sure is busting her hump just to make sure that everybody is aware of what we've got to do in the trenches with the patients, and then to get kicked in the teeth because one of our vendor messed up in such a way is just it hurts. It hurts because it's just like what am I supposed to do?
And I feel like
How do I
the
train
patient
my
doesn't.
staff for this?
I'm not going to say, I'm not going to speak to all, but I bet majority of patients don't understand that background noise, and who they're going to look to blame is the provider. and the staff.
Oh, always. We're the face of this mess.
Yeah. Yeah.
We're 100% the face of this mess. And the worst part is, there's nothing you could do. There is not one thing any one provider, any one organization that did any business with change could have done to prevent this.
Mm-mm. Which
It
makes it just
sucks.
unfortunate. You're basically rolling with the punches right now.
Well, yes. And so this is where the understated education of patients, most people, let's put it this way. Everybody that's in this chat with us, everybody that watches this video is in some way, shape, or form familiar with healthcare, at least in the US. The level of complication that the US makes it for healthcare, and honestly worldwide as well, it's wild. Because you have the complication of understanding the actual clinical job of I am provider, that is patient, decision making based on what the patient's health is. Cool. Now we also have the administrative side, compliance,
Yep.
human resources, running the business, marketing, managing vendors. you know, then on top of all of that crap, we have the billing side, which is wild. Because how I bill Medicare is different than how I bill Medicaid. Both are government programs, which is different than when I bill VA or TRICARE, which is different than when I bill private insurances, which is different than when I bill workers' comp, different than when I bill Geico or Aflac or Blue Cross. And then on top of all that, you have the cash pay patients. In any one practice, Ray, you have 15 different fee schedules. Because this is the one
Wow.
for Medicare, this is the one for Medicaid, this is the one for Blue Cross, for
How do you keep
workers'
up with
comp.
that learning
For
curve? Is just that's so much
so
that
and
goes
oh,
into it.
it's such a pain. And then the contracting. When you're contracting with the insurances, you got to go code by code. Hey, well, they're going to pay us 120% on this code, 110% on this code. So there's three different ways. And then within the billing, that was just getting paid. That's not even getting them to pay for the services that the
Right.
provider has decided is clinically necessary with the patient's input. Now we got to get the prior authorization. And then we've got to go through this process and this process and this process before they will pay for the service that the clinician, who is actually bloody seeing the patient, has decided this is what they need. It is wild. If we
I'm
were to
just
go,
imagining trying to draw this out in like a tree and how many branches this would have.
Ray,
It's
if
like
I broke
endless.
this
It's
down
like endless.
in just the different categories that I just did, I would have three giant whiteboards, and you would think I was finding out if there were two shooters or three for JFK. Was he really on that grassy knoll? You would think I'm arguing whether the world is round or flat if the moon landing actually occurred, because it's just so ridiculously complex. And the wild part is this. You ready for this one? All this nonsense 40 years ago, actually, no, I take that back. Less than 35 years ago, you realize that 90% of this crap didn't exist. HIPAA did not exist. The EHRs did not exist.
Hmm.
The major medical insurances did not exist. You had Medicare, you had Medicaid, you had cash. Everything was on paper. Somehow our system worked, but we inputted major
But
medical, and
according to
now
them
we're
back then, it
here.
didn't.
Like it's in less than one generation, we've gotten into a situation that's so complex that situations like this occur. Um, I don't know the correct answer. for how do we prevent this? I don't know how this is going to go, but I do know that at the end of the day, somebody craps and we're the ones that wear it because we're the ones that work with the patients directly.
I
So
mean,
whether
it
we
almost seems
screw
like
up,
it's just getting worse and worse and worse. Eventually, something's got to change for the better.
well, it's almost like older brother syndrome, right?
This could
Like
be
it
the
doesn't
wake
matter
up
if my
call.
little brother does it or I do it, I'm gonna get in trouble for it, right? So how do we? You've got to what we're doing in our practice and what we're recommending to our clients is do what you can. Identify where the holes are and then plan for your contingencies based on where the holes you are, the holes you know exist. So, for example, if you know that your business is tied to one EHR and that EHR is our entire ecosystem for administration, then you need to plan for in case that EHR goes down for whatever reason. It could be an update, it could be internet, it could be power, it could be this. Um, but you need to plan for those kinds of scenarios. And then you need to decide if the juice is worth the squeeze, or maybe again, you need to decentralize your own practice and have multiple vendors doing multiple things so that way you have checks and balances. Because if you have an EHR and you have a billing company that are separate from each other, they can keep each other on their toes. If one goes down, the other one isn't, you can kind of keep moving. If one is messing things up, the other one, because it's not financially incentivized to go along with the same line, is going to push
Hmm.
and say, "Hey, why are you doing this? Why can't I get that?" So you have your vendors kind of just keeping themselves accountable on top of you holding all of them accountable. I know right now I'm telling all of our clients and our practice we're telling all of our vendors if you're signing a business associate with us, I want a list of all of your vendors that have EPHI or PHI in general. If you Because I want to know what is being white labeled, what services are being outsourced, because I need to know where my information is because the federal government holds me liable at the end of the day. The patients hold me liable at the end of the day. And then you decide if that's an acceptable risk for you.
We call that a BAA attestation, and
Yeah,
that's something
yeah.
that's something that Epi Compliance provides as well. And whenever you're sending out an agreement to your vendor from your Epi Compliance account, you also have access to that document, and you can send that in a follow up to them as well. And like you
Because
said,
you want them
it's
attesting. You
checks
want
and
you want to
balances.
hold their feet to the fire
Oh
on
yeah,
this kind of crap. You know what I mean? Like, I'm gonna wear the black eye. There's nothing that we can do about it. Perception's more important than reality, but you're going to feel this.
right.
So, like a larger company like Practice Fusion right now, I can ask for the HIPAA risk analysis, the security risk analysis. I can ask for, hey, have you practiced against breach attempts? They're not going to give me the report, and nor do I expect them to give me the report. But what I do expect is for somebody to come in and say, yes, we are doing it.
Right.
And if something occurs, that
That's
person's
huge.
words is getting thrown in their face. Like I'm gonna be petty as hell. Like I just caught
AKA
an
somebody in their
ex
legal
cheating on me.
department.
Oh, bro, yeah. I mean, and these EHR
I was
companies,
gonna.
they train their customer service people. They will not walk into that.
Oh,
They
I've
know it's a landmine,
I
especially after this
see
Change
that
Healthcare thing.
firsthand all the time where customers, like I said, we have a functionality for our customers to send out business associate agreements through our platform. And I always just mention, don't ever send it to a salesperson because they're going to
Oh,
prolong the
no,
process. They
don't
are
send it to
trained
customer
not to
service.
sign those things, and they're gonna, like I said, they're gonna prolong the process. They're gonna shift it to their legal
Absolutely.
team, and it's
Absolutely.
at
So
the end of the day, it's not gonna go
every single organization should have a compliance officer because that is required of them. So these kinds of things just take directly up with the compliance department or compliance officer.
Right.
It may take them some time to answer because they may be inundated, especially with everything going on. But you want to have your T's crossed and your I's dotted, because if they screw up, you want to be able to kick your feet up on your desk, call them up, and tell them, so how did you screw this up? Because this piece of paper you sent me, this email you sent me says you did this.
I would also argue a lot of those EMRs, and it might not be the same case for you, but I see a lot of them. They'll have you sign their version of the agreement.
Yes, yes, they will have you sign their version. Now, what a lot of times they will do as well is, for a variety of reasons, which Dawn can correct me for the eClinical specifically, but if you are getting different services, so there's a BAA and a contract for the EHR, then there's a BAA and a contract for the billing side of things, because a lot of times they're separating the organization into different pieces. So, for example, if you use Allscripts or use Practice Fusion, they're both owned by Veradigm.
Mhm.
Veradigm is the one that you're actually getting the billing contract through. The EHR is Allscripts or Practice Fusion, if that makes any sense. So basically, you need two BAAs, one with each organization. So even though it's the same company, it's not the same company.
Separate entities.
If you don't have separate BAAs done, that means that they truly have the billing in-house. Which makes sense. I've seen the eClinical system, it's been a little bit. Usually it's you'll know it a little bit better because the billing people have a better grasp of the EHR when you're talking to your billing person at the EHR company. They may know how to use that section of the EHR even better than you do. That's how you feel a little bit better about it. But definitely your biller, yes, Don, your biller should definitely know. Um, if it's, and they'll know because you can straight up ask them, hey, when you get paid, what name is on that paycheck? Does it say eClinical or does it say Acme Corp? So they will know if they are part of the same organization or not. If you don't have a BAA, Dawn, that gives you a way out, because you could just end the contract. Now you have the other problem of where you're going to send things through, but that's a whole nother bag of tricks, which we're more than happy to brainstorm with you separately from here, because we're gonna have to get into a lot more details. But yeah, I mean, so basically, if you have an IT, make sure things are covered. If you have vendors, make sure that they have things covered. Just ask them. I want a list of your vendors that have PHI. And then go from there. And then you can and I'm more than happy to throw Change Healthcare in front of the bus and be like, look, this nonsense with Change is making me worried. So give me the
Honestly,
information I'm looking
you
for.
might get a response quicker. You bring them up.
Yes, yes, you might get a response
Yeah.
quicker. So I would definitely go and say, like, this is going to be very, very interesting down the road. I don't think anybody's going to go to jail. Let's be perfectly clear. I
Why
know
do you say
that
that?
right now United Health Group is saying they're expecting a loss of 1.6 billion from this thing. From by the time everything's said and done. I believe that number is only based on the amount of lost revenue during the period that Change was down. I do not think that that is including the payouts that they have done or will do. So that
Right.
number could go much, much higher.
Right. Very
You'll
interested to see
know.
what that number
Well,
is turns out to be.
you'll know before they make any kind of press conference. And you want to know how? Keep an eye on their stock. If that thing dips, that number's going up.
What's their ID, Jose? What? I'm gonna have
Huh?
to. I said, what's their
Well, it's
what's their
UHC.
what's their
It'd be
ticker?
under United Healthcare. So I think it's UHC on the stock exchange. Let me double check. 1 second, I'll tell you right now.
Follow the money.
Healthcare. Yeah. Stock symbol
Yeah,
UNH.
UNH. Yeah.
Yep. Right now they're at
And she's taking a dive.
484.62. Yep. But if you look, you can look at their, last 6 months or whatever. They've been diving pretty hard since the 26th of February. They've stabled out in the middle of March and then they nosedove again at the beginning of April.
Yeah, they've been.
Apparently they've been on a bit of a climb since the 12th of April. I'm kind of surprised, honestly. But it must be because they're back up and working, so people think they're not going to lose as much money.
Right.
I wouldn't bet on it. But yeah, so that's just me. My complete non-financial advice is I would short that stock. That's a whole
Yeah,
nother bag of tricks. I would, yeah, it's a whole
100%.
nother bag of tricks though. But yeah, so that's what we got kind of for today. I mean, I don't have anything else on this yet. If this is something that everybody's kind of interested in, we'll probably be able to revisit in the next 3, 4 weeks. If not, probably closer to 6, Ray, because I think that with
I just
them back up and running and admitting there was ransom that they paid a ransom, plus the
all
um
the
1.6
lawsuits.
billion that they're expecting to lose from this, unless something major happens. I think this one is this well is kind of tapped for the next 6 to 8 weeks until something else pops up or some more information comes out. But we'll definitely
Yeah,
be
we'll keep an
dropping
eye
that
out.
information as quickly as we can keep an eye on it for. So,
No,
any
absolutely.
questions, concerns, guys?
I was gonna say, if you guys have any questions, feel free to put them in chat.
It's just
You
wild,
can always
man.
interview Dawn, and
I want
and
to. I want to.
and have her talk about the process that she's going through right now.
And
Could be
yeah,
beneficial.
probably 6 to 8 weeks. She'll probably know she's got to pay those loans back from United that they were offering.
They were at 0%,
So
0% interest.
0%. If they should just write that off and follow it up with a piece of paper saying you don't hold us liable.
Wow.
That's what I expect will happen. Either that or the claims that everybody's pushing through right now to United may have a little bit more of a bonus than their contracted fee schedule.
Right.
Because
From Optum, let's see
I'm sure.
another.
I'm sure. Yeah, Optum got hosed pretty hard too because they're pretty big on the pharmacy side and the HSA side. So definitely, yeah, Don, we may need to get you on here so that way
Don, we'll be in
we can
touch.
hear from somebody super affected by it. Since I was only tangentially affected in our practice, I'll even be honest with everybody here. At Q3 of last year, we accepted all insurances. Q1 this year, we dropped everything except for Blue Cross and Medicare because I was just tired of having to deal with all the different fee schedules, all the nonsense, all the different products. Um, and at the end of the day, the patient was just ending up having to pay us, except I'm having to call them up in October about a data service from January. Like it's because we had to go through all of the process. And they're like, you can't have this product anymore. And I'm like, I know, but in order to go through this whole product, it's a wild thing. Yeah, I'm sure. Yeah, some of the ACOs offered early payout,
Early payout.
based on, yeah, and they got that from a bank, Don, I'm sure. And now we're down to just Medicare. We dropped even Blue Cross, which I got a little bit of pushback from people, but honestly, it's been smoother. It's so we only take the only insurance we take now in our mental health practice is Medicare. We've dropped everybody. It took some of our patients, there was some pushback. And I'm not going to lie to you and say that it was a smooth transition and we kept every single patient. That's not the case. I believe that we lost about 15%, dropping all of our patients. But if I take a look at last year, it was almost as if I was doing services for free.
Right.
So screw it. The private insurances don't want to play, and they don't want to. And I believe that they're working in a way that is not honest or fair for the patients or for the providers. Screw it. Have fun in Congress when everybody starts complaining about narrow networks and ghost networks. Yeah, you've got 30 providers on your network. Not one of them is accepting new patients. So do you really have a network? Do you really have access to care?
Network insurance.
Miss me with that. Miss me. But that's just me. Again, our business is a little bit different. The area that we're in, I would definitely recommend take a look at everything that and your or the way your business is set up, what's going on in your specialty, and then make those kinds of decisions as you go. But the less vendors you have, the less liability you have. Somebody else screwing up. I just thought about us screwing up now. Or somebody hacks CMS, then I'm screwed.
Yeah, then we're all screwed.
Yeah. If somebody
The
hacks
goal is
CMS, we're all done here.
limit your liability.
Yeah. Yep.
Or
So moral of the story, TLDR,
have
know
systems in
who you're doing
place.
business with. Know who you're doing business with, and then trust and verify.
And that's
So
certainly something that Jose and myself can help out with. If you guys have any questions, concerns, please let us know. Jose's, as I mentioned, he's on the consulting side of things, and the company I represent is Epi Compliance, and we specialize in healthcare compliance, specifically with HIPAA, OSHA, Medicare regulations. Jose was mentioning earlier contingency planning, business associate agreements, attestation. That's all things that we provide through our online solutions, and our goal is to keep everything in one place as far as the compliance is concerned and make our customers lives easier. And which brings me to the next subject.
actually leads into next week's topic, doesn't it?
Hey man, you stole my thunder.
I like
uh,
that
so
segue. That's a
so
good
uh
one.
so next week we're going to be and again, I see some current customers that are on this webinar. Appreciate you guys attending. We just released the latest version of our platform, and again, the goal is to streamline these compliance processes, make it simple for you, your staff. And we've come out with a new user interface. It was released released yesterday, and or
Oh,
yesterday morning, I would say. So again, if you guys have any feedback on the current platform, do let us know. We appreciate that greatly. Positive, negative, let us know. But like I said, our goal is to sort of help make these processes on our system easier. And again, we're going to be talking about that next week. We're going to do sort of a little bit of a workshop, talk about the importance of having compliance programs in place versus doing things in house, and obviously giving you guys a little sneak peek of the current iteration of our system. So
the
you
new
guys
one,
will be
the new.
receiving some correspondence for that, and a registration link and all that good stuff. And we mention this in every webinar. If you guys have any topics that you'd like us to discuss, obviously in the healthcare realm, preferably, do let us know. Always looking for new subject matter to speak on, and especially if it's something that's going on, currently, like this change healthcare stuff. So, um,
Yeah, I'm gonna take a look, see if there's any new final rules that the government's proposing, see if there's anything interesting. Because again, if you don't pay attention to the rules that are changing, you're gonna be behind the curve.
mm,
Take a look at what's going on. Take a look how everything's going to affect us moving forward. So that way you can actually properly plan for the year coming up. I know it's hard to do if you're a fireman like myself, where you got 40, 50 hours a week and just nonsense. And then how am I supposed to plan for the future? But it's about accountability. It's about planning ahead. If I can't look around the corner, doesn't matter what I do today.
absolutely.
So
The certified
cool, cool,
firefighter.
cool. Yeah, right.
that's that's why we're here to help, you know, because again, when you're doing everything to run a business, you know, the compliance stuff tends to fall on the wayside, and that's where we come into play. Make it simple for you, so where you can log in and manage all your compliance seamlessly with your trainings, your accessing your policies, your business associate agreement management, all the above. So, but we'll get into that next week, guys. And again, appreciate your time. And Jose, as always, appreciate you being the co-host. And
And
we'll see everybody next week. As I mentioned, there will be a registration link that will be sent. And look forward to seeing you all then. Okay. Take care,
yep.
Jose.
Have a good one, guys.